first of all, can I welcome everyone to the this meeting? It's the first OPAF meeting we've held via Zoom. During the lockdown time, the steering group have been keeping work and keeping communication going, but we're hoping that this method will enable everyone to join in and see where we're at and take advantage of the speakers that we have. So thank you for joining, thank for the members, and thank for everyone else who's joined the meeting who's not a member. I'm certain that our membership people will be asking if you wish to join as a member afterwards. Can I ask if people could at some stage during the meeting just introduce themselves in the chat box as to who they are, and if they're from an organisation? That will give us a record. That would be really helpful on that side. And again, I'd ask if people could mute during the presentations, and any questions during the presentations put in the side chat box on there. I think that's about all I need to say at the moment. Is Roger here?
Yes.
Yes, I think we're going to say a few words about Colin, aren't you, Roger?
Yeah, yes.
Hand over to Roger, who's our chairman of OPAF.
Yes, everyone. I'm Roger Panton. I'm the chairman. And the announcement this morning is that a couple of weeks ago, our elderly webmaster passed away. He was 90, one day short of being his 96th birthday. So he was a wonderful old guy, and if you would like to, you can look at the OPAF site. On the news pages there is an obituary for him, and he'll be sadly missed. He was a great character, and well, that's about all I can say about it. So he did a wonderful job for us over the years. He was with OPAF over 10 years, so greatly missed. So back to you, Rod.
Thank you, Roger. That's sad. It's good to remember Colin. In terms of the meeting, we're fortunate to have Dr Adrian Hayter with us today, who will be giving the presentation. We're also joined by Michael Murphy, who's the Director of Statutory Services and the Deputy Director for Adult Social Care for the Royal Borough of Windsor Maidenhead, working with Optalis as well. Oh, I've lost where I am now on my agenda, so apologies for that.
Well, don't forget Greg Jones. He's our.
Absolutely. I said I was lost. And
Sorry, Chair, can I say good morning as well?
We've got our RBWM Royal Borough Councillor sponsor, which is Councillor Greg Jones, with us as well, which is very good that people could spend the time to join these meetings and to support OPAF. So thank you for that.
Sorry, Chair. Good morning. I'm finally worked out to unmute myself. Thank you.
Okay, thank you, Michael. So in a minute, I'll hand over to Dr Adrian Hayter, who I've known for several years since we worked together on the New Vision of Care project, which will be part of the presentation. Adrian, as well as 3 days a week as a GP in Runnymede, is also the National Clinical Director for Older People and Integrated Person-Centred Care for NHS England, which is very much an advisory role. He gets very involved with the working groups there, and he's also, for his time, becoming a non-executive director at Bucks Healthcare Trust. I'm not sure how he fits all the time in, actually, but there we are. We're really pleased that you're able to come and give this presentation, Adrian, so I'll leave you to screen share and start it.
Thank you very much, Rod, and it's a real pleasure to be here today to join you all and to be able to.
You've got the combined
link up to the great work that's been going in our area. It's a great privilege really to understand how we've been working together for quite a while and seeing some of the fruits of that labour, and hopefully during the presentation as well as giving the national perspective, I can give you some of the flavour of how some of our work together has been progressing. That work with jointly with the Royal Borough, with Optalis, but most importantly with groups like yourself, who are there to support, challenge, and be able to shape the work that goes on locally. So it's a great pleasure to be here to spend this next kind of 30-40 minutes with you, and really happy to kind of answer questions as well.
Thank you, Adrian. Just a comment, you've got the 2-screen version on the...
Oh, okay, I will, let me just check how to do that. I'll go back and I'll screen it again. Is that better, Rod?
That's it. Thank you.
Lovely. Okay, great. So, I'm going to quickly run through these slides, but I think first of all, I just wanted to just give you a context of where I am, and I'm a GP in our local area at the Runnymede Medical Practice, where I've been for the last 25 years, and Runnymede Medical Practice is on the Surrey-Berkshire borders. So actually we're part of our local Royal Borough of Windsor, Maidenhead place, but we cross over to have some patients in Surrey as well. So I'm here at the Runnymede Medical Practice, and I've been there for the last 25 years, and working with a population of about 12,500 patients, working in the villages of Old Windsor and Englefield Green. We've got 2,500 patients over 65 in our practice, which is above the national average of older people. And I think in general, that's the case for Windsor, Ascot and Maidenhead as well. So we have got an older population, if you like. And when I came to the practice, we had very few people in their late 80s and 90s. However, over the last 10 to 20 years, that the numbers of people growing to and living over the age of 85 and over the age of 95 have been higher. So in my practice, we've got 54 people who are over the age of 95, and like Colin was contributing, some of them contributing to our communities. So I think kind of that's the shape of the practice that I work in, and I've been working in over the last 25 years. More recently, we've been working as groups of practices in these clusters of practices called primary care networks. And this is a picture I took from a plane as I was kind of leaving Heathrow, of our patch, if you like, our piece of Windsor, a primary care network, where we have all the practices across the Windsor group with a population of 50,000 patients. And we've got 177 of those people who are over 95 in Windsor, and obviously one VIP on the patch as well, but also you know, we obviously need to kind of just remember the passing of the Duke of Edinburgh, as well as one of our residents in Windsor. And then more recently, we've been working more collaboratively across a wider patch, and Rod and myself and others worked to collaborate across East Berkshire and especially around the acute services at Wexham Park. But we created this system called an integrated care system across the Frimley patch, and we were one of the first areas actually to become an integrated care system in the country, and now just following the recent white paper, we've moved to all the country being covered by integrated care systems, which is the new way of working really across health and care. And then finally, just going on to kind of, you know, the national role that I'm involved in, we're really kind of looking across, and it's great that we've got people outside of our just our local area here today. So it's great to be able to be sharing work, and that's one of the great things that I'm able to do, is to go and look and see what's happening in other areas. And I did a trip down to Devon, Dorset just before the pandemic started, where we looked at what was happening down there, and some great work happening in integrated care systems across the country. And then I think what we're looking at really is this much more population health. So actually understanding who is living in our particular areas, being a bit more place-based as we are in the Royal Borough of Windsor Maidenhead, and understanding our place, and then thinking about how we can improve the health of the whole population. But from my perspective, the health of people who are living older, as I said, and being able to support them in living better and aging well. And that's the name of the programme that I'm connected to within NHS England and Improvement. So I wanted to, and Rod mentioned the new vision of care, because I think this preceded the integrated care systems. And a new vision of care was, this came out of the changes at our local hospital at Wexham Park Hospital. Now, when I was a clinical chair of a CCG back in 2013, one of the biggest issues was the acute hospital at Wexham, and not only the financial sustainability of that hospital, but also the quality of services. So we had to work really hard with a whole host of other CCGs and with the NHS and Department of Health to be able to provide a package of care to support Wexham in really delivering better quality care to our residents, not only in the Royal Borough, but across Slough, Bracknell, and into Buckinghamshire as well. And so out of that, what we aimed to do was to not only think about the benefit of improving hospital care, but we actually said, well, if we're going to improve hospital care, we also need to think about how we're going to reset care for the future and think about a new vision of care, which will then allow people to age actively and well. And if you look across this slide, you can see the 7 stages of kind of care as we grow older, and how we can support those in a slightly different way to the way that historically has been happening around people receiving episodic care in different places and less coordinated. So we've got from people living with particular conditions in their life, but also thinking about how we can support people to prevent illness, as well as supporting active aging and independence. And I think we've got some great initiatives in the Royal Borough, which we've had for many years sometimes, to be able to support this. Things like the leisure services, and how the leisure services support people with activity as they grow older, and help with their stability and their posture, and prevent things like falls. So we want people to live with long-term conditions. We want people to be supported when they start to develop much more complicated and complex conditions, where things interact, like your diabetes care with your heart disease and with your renal or your kidney disease. So all of these things kind of come together, and what we want to do as a system is to really kind of support those kind of needs that people develop as they age. And then actually we really want good hospital care, which is what we've been trying to achieve at Wexham, and improve the standards of care when people go into hospitals. But then recognise that that's not only kind of when they are in hospital, it's actually when they come out of hospital, and then getting good quality nursing and residential care when people have to leave their own homes to receive more intensive care, and then also at the end of their life. So these are the 7 stages that we identified. And what we did in this new vision of care was we worked really well with a whole group of people across, and this was around 2014, 15, when we were designing this. And it took us a year really, with people like Rod and many others who are on this group, Julia, contributing and having this dialogue around how we can develop a better way of working in the future. So let's see. So the next bit on this diagram really shows how people really wanted to be kind of accessing care locally to themselves. They want to be at home, but surrounded by their families with multi-skilled teams and within the local area, but access specialist care and hospital care when it's necessary. And with that, we designed in our system some key features to that, which is, first of all, this person-centered promotion of care. So actually kind of thinking more about individual choices rather than labeling people as being diabetic, thinking about how we can say, well, you are living with diabetes. How can we then support you to live better with diabetes, to think about looking after yourself, and actually how we can kind of then get in early, if you like, to prevent illness from happening. All the way through to kind of thinking about much more coordinated and monitored care, because people sometimes get lost in the system of care, and we have to strive to do better for that. And then we've got some key enablers of care here, which I think are really important, because this won't happen unless there are changes that are made. And some of that are kind of system changes and very kind of organizational changes, but some of that is actually around leadership and how we work together across the Royal Borough, across health and care, to be able to collaborate, to have a goal together. And, you know, the pandemic has shown us that when we've got that goal together, we can really deliver at pace and at speed. So I think kind of that collaborative leadership is really important. So this is what we co-created. This is our success, if you like, and our legacy over the last few years has really kind of ramped up, and there are these features you can see are developing in our system over the years. And I hope I'll kind of talk a little bit more about that as I go into the national perspective and kind of reference the work that's been going on locally. So my next slide, if I can put it up. Sorry, let's go back. So this was, I think, and I really wanted to show you this slide, really, first of all, in memory to Mike Connolly. Mike, you can be seen in the picture on the right-hand side. And Mike actually was a lay member from Slough CCG. We worked really closely on New Vision of Care. He supported New Vision of Care in a way that was really a key element from a lay perspective, to be able to challenge, support, bring groups together. Rod's there on the other side of the picture, and then we've got a group of professionals kind of in the middle. But Mike said, in order to enable change, everyone needs to play a part, and those words are so true in terms of we all have our responsibilities to play, and it's actually through meetings like this that we can kind of develop the agenda, make things much better. Mike unfortunately died during this pandemic of COVID, and he's going to be sorely missed. He was a real patient advocate. He was a real active member of his community in Slough. The other so let me just go on to the next slide. So I'm having difficulty. Okay, and then I wanted to just from my perspective, people say, what's integrated care? And this is part of my title, you know, National Clinical Director for Older People and Integrated Person-Centred Care. Well, what's this integrated care all about? And I wanted to describe integrated care from what I see as my perspective and my understanding. And on the picture on the top left-hand corner, right-hand corner of your screen, you can see a patient of mine, and I had his permission and his daughter's permission to share this. This is a story really where in our practice, the daughter who lives with her husband has a long-term condition, and she actually suffers from that long-term condition and needs support from her partner. And that support about 5 years ago crashed down because her partner unfortunately didn't receive the flu vaccination. And he was one of the really unlucky people to develop a really rare form of flu and go on to develop some devastating consequences. And he went into he had to go and be transferred from Wexham to a specialised centre where he received breathing support. During that, he had some organ failure and some other conditions, and he spent about 9 months in hospital following the flu. He was the carer for his wife, who's there, and she in turn was the carer for her father, who also lived in the village and was in his 90s. When her husband was in hospital, her world came crashing down. So not only could she find it difficult to support herself, she was finding it difficult to support her father as well. And her husband was in hospital in London, and she was worried about her finances. She was worried about being able to keep her home, but also all these other things. Well, a year before this incident happened, we had started working with through some great connections with our local parish councillor, Lynn Jones, who's been a real advocate for services in Windsor. And we actually kind of had the support of linking a social worker to our practice. And we had that support where we had regular work going on between the social worker, Deborah, and the practice. We had regular meetings, and we got together to support this family. And actually, when her husband came back, when things were slightly better, she said, through the support from not only the practice, but really more from social care as well, and a bit more joined up care, she was able to keep going. She was able to keep supporting her father. She was able to get her husband back and support him in his rehabilitation back. And really, for me, that's true integrated care. We're not, we're not saying that this is coming from health. This is coming from social care. We actually are working together to support them. And I was lucky to go over to have a cup of tea on his 100th birthday. And during that time that I spent there on his 100th birthday, he said to me that really I wouldn't be here if it hadn't been for the approach that we had given. And that's not necessarily a health approach, it's a true kind of approach. So one of the most important things in the last few months of his life was actually the chair. You can see he was sitting there on a chair which wasn't as comfortable as it could be. And so after this, we tried to arrange for a kind of a better chair for him for his legs to be raised and less, so they would be less swollen. And actually that made a huge difference to him. So it wasn't what I did as a doctor necessarily. He unfortunately died about 6 months after this picture, but really that is true integrated care. And that's what we're striving for in the work that we're doing, not both locally, but also nationally as well. Sorry, just still struggling with these slides. Hopefully you'll bear with me. That's it. Okay, the next slide really is what I'm going to be just kind of concentrating on in the next kind of 20 minutes or so. So I wanted to introduce the concept of integrated care. I wanted to talk a little bit about the long-term plan. This is one of the plans in NHS England and Improvement, which we've been kind of concentrating on over the last few years, and then think about integrated care in the Frimley system. So really, the NHS has been pushing towards this integrated care for many years now. And this is really kind of joining up the support across councils and the NHS, which is, so it's great to have, in this meeting here today, us joined really to local councillors, to local officers, to be kind of joining up that work, because this is what we need in an integrated care system. And really in the beginning, it was more a coalition of the self-willing rather than a kind of something which was a structural change. So that's really why you didn't hear probably a lot about it, and it started to emerge. And Frimley was one of the first 10 integrated care systems in the country. And then this is the integration and innovation white paper is actually really kind of putting a little bit more into kind of some of the statute, the way that we're going to be working in terms of improving health and social care for all, removing some of the barriers that have been existing, using legislation, getting accountability and responsiveness to people, and actually kind of making a bit more of a structural change. Please read some of the papers. It's interesting. There were some gaps in it, I think, especially around kind of long-term social care funding, but however, the place that we're going to is actually much more of this integrated agenda. And then finally, the long-term plan. Right. So the long-term plan is actually kind of an investment in the NHS over the next few years. And by 2023, this is recurrent money, which is kind of being invested into health services with some growth, which has been for the first time growth in the NHS. And a real investment of £4.5 billion in primary and community care. So actually, you know, your primary care networks have some investment for new roles, for new ways of working, together with community services, which are often forgotten about when it comes to extra resources. And the chapter 1 is worth reading. It's around how out of hospital care has been boosted, how we're redesigning emergency and hospital services, how we're developing much more personalised care and using digital enablers to be able to do this. So this long-term plan really was the focus of our ambition from 2019 all the way through to 2024. The next slide is actually, as well as the ambition of the long-term plan, we've also got the consensus for healthy aging, and this is actually what we're aspiring to in terms of public health initiatives in terms of healthy aging, and some initiatives also which connect up to the WHO decade of healthy aging, which is between 2020 and 2030, which really has an ambitious task to try and increase the amount of healthy independent life, but also by reducing some of the health inequalities that occur in older age. Now, I put down here just some of the important elements from the Ageing Well Programme and the Healthy Ageing initiative. And I'm going to then move on to talking a little bit about frailty. Now, this is a word that a lot of people don't recognise, and a lot of older people don't recognise frailty. So forgive me if I use this word, but it's what we're thinking a little bit more about as professionals in terms of how people age and how we can find the people who age better than others, and also think about targeting some of our resources on some people who are aging less well. And this is data from 2017 across the country, which showed and uses a way of working out how people are from GP data, from our GP records, and thinks about things like loss of sight, loss of hearing, loss of certain factors, which then contribute all together to be able to make somebody a little bit more vulnerable, or identify someone to a professional as being more vulnerable. So this is the data that has been collected, and you can see here right at the end, that last slide of the 95, the people who are 95 plus, a lot of those people are actually still aging well. You know, you've got 20% of people in there who are 95 who actually are aging well. And in the other categories, there are people who are living with mild frailty, and there are people who are living with moderate and then more severe frailty. So age doesn't necessarily mean or equate to frailty. And in our Frimley health system, we've actually used some of this data to actually then go on to say, how does that mean? What does that mean for GP consultations? What does that mean for hospital attendances, etc.? And we use some of this work in our work in the Frimley ICS as we've begun our journey around integration. Sorry. So we are changing the way we think about something from a system where we talk about people who are frail elderly, who and really kind of think about when it's often interventions when they're too late with that crisis presentation and episodic hospital care, to actually managing and supporting people to live with frailty, but actually provide some timely identified way, some proactive care, and actually bring some of those community services and the person-centered coordinated services. And those services don't just involve statutory services, they involve working with voluntary services and any community assets that might be available, and you know, the work that's been going on in the Royal Borough, like the work in Men in Sheds and other areas, actually kind of shows how if we pull all of those things together in a coordinated way, it actually makes a better sense, and it brings a different type of relationship in. It's actually much more of an open relationship. Where people pull together rather than a kind of a hierarchical relationship. So these are the three main programmes of the Ageing Well, and this is where some of that £4.5 billion in investment is going. The first thing is an urgent community response. This is actually a 2-hour, 2-day standard, and that means for us as individuals who live within the Royal Borough, it means that if we are in crisis, that we can get a response within 2 hours coming into our home to support keeping us in the home if that's the right thing to be doing. And then when you leave hospital within 2 days, and if you need rehabilitation support, if you need physio and occupational therapy or other support to keep you living at home, then that help will be there within 2 days of you leaving hospital. And this standard was brought in January of 2020, just before the pandemic. And Simon Stevens launched the work, and we launched it with 7 accelerator sites. Our local area wasn't one of the accelerator sites. The west of Berkshire was. But however, during the pandemic, a lot of these proposals around the urgent community response have been put into place. And we are really rolling that out now. And I had some conversations with one of the local directors in the Frimley system around what they're doing for that. It builds on some of the work that which already exists with the short-term and reablement teams that we've got. It makes it a little bit more of a standard offer. Is looking to make it's going to be 7 days a week, 8 to 8 initially, but eventually 24 hours a day. And actually, this means some really joint working between the Royal Borough and between health to be able to deliver that urgent community response. The second area is the enhanced health and care homes, and this was, we know that during the pandemic, care homes have been disproportionately affected by the pandemic, and that has now this was launched in October, where we're now doing regular, we've got nationally a regular visit to care homes, a weekly ward round, where clinical teams are supporting the staff in care homes and being able to improve standards of care around dementia care, end of life care, thinking about nutrition, oral hydration, and as well as oral health. So there's some of the features of the enhanced health and care homes are going to be kind of pushed forward over the next few years. And that really does mean the community services team working with the primary care networks to deliver that enhanced health and care homes. The third thing is a group of people where we can identify them. Now, I showed that slide about people living with frailty. Well, this group is people living in the community who have been identified to be the most vulnerable, and not only necessarily living with frailty, because other groups are also vulnerable, but we're aiming to try to get those people into into a program where we can kind of support them with a care planning approach, and where they're involved in supporting in their care, in their needs as they age and as their conditions become more complex. Sorry. So this is what Simon Stevens said about the urgent community response when it was launched in January 2020, and I've explained about these three things. I just wanted to bring in this slide, which is really kind of what has been brought in during the pandemic around the personalised care agenda, which is a new programme, as well as the Ageing Well programme. We've got a programme called the NHS at Home, and this does use a little bit more digital initiatives and devices which are in people's home. And this has really been brought about because of the pandemic and the need to be able to identify people who deteriorate early. And you may have seen some of these things called pulse oximeters, which go on people's fingers to monitor oxygen levels. And that's one of the features of NHS at Home. But actually, this is going to be another part of the long-term plan programme, which is how we can support, you know, if you have simple devices like blood pressure machines and others, how can you be supported to use those in your own home environment in the right kind of way? So that's what the NHS at Home programme is about. And this is a bit more about it in terms of that proactive element for the NHS at Home. So I just wanted to quickly move on to talking about digital health, and then to really kind of give an example of how we have done some of this work in the Frimley Health System. So actually, the WHO in about 2019, actually, and this is in Chinese, but there is an English translation to this, but it actually showed the important role of digital health in health systems. Now, we do know that obviously digital health is not just around kind of people being able to access healthcare through a digital way, but it's actually about how we use digital to be able to reach out, and as well as that, find the intelligence for supporting communities. And this was some principles for that, which were launched by the WHO in 2019. And in the UK, we are really privileged. If you go to most other countries, they don't have the ways of the health record. And in general practice, throughout my career, we have dealt with an electronic health record. So 25 or more years of an electronic health record, which has a wealth of information to be able for us to be able to reach out and understand what's happening in our populations. So this is just a timeline really of kind of that rich electronic health record, and EMIS is one of the systems that you will be part of your health record across the Royal Borough of Windsor Maidenhead. Most all the practices actually have an EMIS record. And volunteering during the pandemic has also engaged this digital agenda with the Good Sam app. You know, we're all used to apps, but this way people actually were able to volunteer and support their communities through the pandemic. The COVID oximetry at home, I talked about those little kind of devices which go on your finger to tell you oxygen saturations. Well, what we learned very quickly during the pandemic was that if your oxygen saturation was between 95 and 100, then actually most of the time you could be cared for safely at home. But actually, once your oxygen levels started to drop to 93, 94, and then below 93, that showed a danger sign, because actually mortality increased exponentially. And actually, based on studies which kind of were taken through the pandemic, we knew that there was this important level of oxygen saturation. Now, this was taken, and fortunately, before the pandemic, the NHS actually procured a huge amount of oxygen saturation pulse oximeters, and we were able to use those and deploy those in a COVID assessment pathway. Sorry. So what we did was deployed those, and actually in our own area across East Berkshire, we actually deployed that in a particular way, which I'm going to tell you about as part of the Frimley Connected Care programme. So oximetry at home was really there to help look for early deterioration, get people into hospital as quickly as they could, and then get and get them supported in the right kind of way if they develop COVID. Then the last thing that was brought in really right at the end of this in this third wave of the pandemic was something called the COVID virtual ward, which was when people were in hospital, actually then they could be safely discharged home and supported virtually in their home environment with support and monitoring by clinicians from the hospital. Sorry. So just going on to the Frimley Health and Care System, we're actually kind of really wanting to work with our communities to create much more healthy communities. And we've been investing in this connected care record, which Rod has been involved in, I think, in terms of supporting that programme. And really, this has been a real joint effort between local councils and the health service, and the investment has gone on between the local authorities and the health to be able to develop this way of working, to get the data, to be able to think about the information governance as well and the communications around that, but have an underpinning infrastructure to be able to develop this care. And if you like this, we've also done this across West Berkshire as well. And there's lots of data which has been kind of gathered, whether that's not only general practice data, but data from the hospitals, data from the community services, from the out of hours services, and 10 billion data items across 139 health and care organisations. So a huge effort to kind of put all of this information together in a longitudinal record. So during the pandemic, what happened was that we were able to use this connected care programme and the data that was there to be able to make that oximetry at home and make it as seamless as possible, so that when someone was tested and was shown to be positive, and when we were able to then work out their demographics, you know, who the people who are going to be most vulnerable to detecting the complications of COVID, we were then able to onboard them into this oximetry at home, and then be able to support them with with a pulse oximeter and with some virtual support to be able to detect the people who would deteriorate most quickly. And this is how it happened in the technical aspect. And there was an app which was produced, a list, and people were then able to self-monitor. And then for the people who deteriorated, they were able to get into hospital earlier and be able to have an improved level of outcome following their admission. So this was one of the features, if you like, of how this was done. And this is the kind of the way that the information was relayed to the clinical teams, and the clinical teams through the out of hours services were enrolling and supporting people. As soon as the test and trace data came through into our system, we were able to onboard them and get them and the right kind of level of support. And finally, the work not only was through Connected Care, not only has given us the potential to do that, but has also developed lots of different insights. And these are just some of the insights that we've got in our system to be able to improve care. And these are some of the things that the clinical teams are working on. I'm sure Rod has been involved in some of this work in terms of developing some of the work with the clinical teams. But it looks at real local insights, and you can see kind of from those local insights what's happening. So I'm gonna, I've probably talked for too long. It's been about kind of 30 or 40 minutes, but I'm really happy to answer questions in the last kind of 10 minutes or so, or to be able to kind of interact with you. I'll stop sharing this screen now, Rod, and hand back to you.
Thank you, Adrian. That's a really good insight to what's been happening and what's going on. So I hope people found that interesting. I'm sure I did. Is there any specific questions, anything anybody would like to ask? I've got Greg. Go on, Greg.
Okay, Adrian, that was really very interesting. I know that doctor surgeries have changed very much the way they deal with their patients over the last year or so. Are there any lessons that you think moving forward we're going to embrace, or you're going to embrace as a doctor? Are we going to see more online consultations and, you know, less face-to-face? How do you see it going?
Yeah, really good question, Greg. I think life in many respects is going to change for everyone following this pandemic. This pandemic isn't over yet, and we've still got a lot of a lot of challenges still to face, even though we're in a much better position now than we were in the past. So I think in terms of general practice, what I've learned as a GP is that some of the changes that we were starting to implement and starting to think about, actually we had to just get on and do, and actually came about much quicker than we expected, and we had to rise to the challenge of using technology in a different way. And I think some of those changes, I think we may not have the public, if you like, may not have been able to have consulted and worked with as much as they would have done in normal times. And so I think we are having to think about how we do things. But I do think that some of the advantages that I've heard in my practice, actually just before the pandemic, we had some consultation we had about 150 people from the village of Old Windsor and 150 people from the village of Enfield Green, and we talked about how we could do things in a different way. You know, what people felt about online consultations, what they felt about telephone consultations. Actually, and most people actually felt that telephone consultations were actually a good thing. It's more convenient sometimes for the patient. It supports the doctor in terms of managing a work schedule. And actually, most people, 80%, I think, in the survey that we had, were quite comfortable with that. Online consultations as well. There was slightly less people who were comfortable with online consultations, but majority were. And I think we've implemented that during the pandemic. And actually, I find that actually as a GP, a lot of patients actually having a telephone call in where they would have normally come into the waiting room, waited, and been fitted in and got an appointment face to face, which would have taken some part of their day out, is more convenient. I had to access my GP recently, and having a telephone call actually was much more convenient for me than having to go from work to the appointment and then get back to work again. So I think some of that, I think what we've also got to realize is that as we open up more, that we can see people face to face. I think it's important, like anything. It's like this meeting here is virtual, but actually we still need to have that personal contact at times with people. And I know that, you know, from the practice, when I see patients, there are some things I can do over the telephone, some things I can do online, but there are things that you have to do to be able to see somebody. You have to do that safely. You have to protect them, you have to protect yourselves, you have to protect others. So I think that will be the challenge, is actually and part of it is around supporting people's expectations of the service that we're offering in general practice. Texting, for example, has been a great piece of work that we've innovated and used. And actually what I find is that texting, where people have got mobile phones, and most people have mobile phones now, it allows me as a GP, once I've done a consultation, to give people more information, and you can link pieces of information to, so for example, when I sometimes prescribe a medication for an individual, I'll send them a text with a link to some information about that medication, which will be helpful to them, and they can keep that and they can refer to that or look at that. And so it helps in that more personalized kind of care that we are aspiring to in the work that we talked about. As well as that, we've got new roles in general practice. So it's not just your GP. So what we've been doing with primary care networks has been developing new people coming into the practice to support the care. So in my practice now, we've got a pharmacist who's fantastic at spotting kind of some of the medication things that come up in the practice. And she works with some of the care homes to do medication reviews. We've got paramedics who have joined the practice, who are able to respond quickly to more emergency type situations in the practice and also see patients. And we're going to have, we've got social prescribing, which we introduced actually through some really good work between the Royal Borough and ourselves before the roles actually came into general practice. But social prescribers link to local authorities and some of the work, a bit like the work that Deborah Dulek's been doing in our practice for many years. It's a way of linking up some of that work. So I hope that answers your question, Greg. We're changing, but we're having to adapt. But I think we do need to communicate more through our patient groups, through other methods, to be able to, for people to understand the changes, why they've happened, and how they can be beneficial.
Absolutely, I agree, and I use the MyGP app, and I can see that's going to get bigger and better as time goes on. We just want to make sure that we don't leave those old people behind, who aren't so tech savvy, who don't have a smartphone, who have still got a Nokia, if a phone at all. So we just need to have one eye on that all the time. But thank you, very good presentation.
Yeah,
thank you. Julia, if you've got a question. You're on mute. Can you unmute yourself?
Yep. Hear me now? Yes.
Yes.
I'd like to ask Adrian about recent reports about the stagnation or even drop in life expectancy, and particularly in healthy life expectancy. And there's quite a lot of reports about that, including, I think, from Michael Marmot, who of course is the guru, really, isn't he, about life expectancy. And I just wondered, are there plans for any initiatives in our communities to target certain aspects of health and well-being, and help people to lead more healthy lives and longer healthy lives? I know that over the years we've had work around blood pressure and diabetes work, but it goes beyond all that, doesn't it? Those are things that most people know about. And I was just wondering, Adrian, if with this new stats showing that life expectancy for the first time for quite a long time is actually stagnating or going backwards, were there any particular plans for our communities to focus on aspects of healthy living?
Really good question, Julia. And I think you're absolutely right. We have, and I described it, we've been kind of, people have been living longer over the time that I've been practicing as a GP, but there is some recognition that that's stalled. I think you go back to Michael Marmot and what his way of thinking is. I think the real way to get this change is actually through some of the social determinants of health. I mean, health is there, but actually, we only account for less than 40% of kind of the influence on health outcomes through the NHS. It's actually some of the outcomes are really from developing life chances right from birth all the way through. So some of the initiatives that that need to be built are really kind of around people's life chances, their education, their housing, their employment, and all of these things are the ways that we improve not only years of life, but actually healthy living, as you quite rightly said. So I think that there is some great work to do, and if you think about the role of the local authority and public health to be able to build some of that in, and what we've got now is a bit of health intelligence around where to point our direction, if you like, of our work going forward through connected care, through the system analytics that we've developed. And through that, we can then target the groups in our community who we know who need the most support, because there's only one resource, either local authority or health resource. We've got to make best use of that resource to be able to target the individuals who need that resource most. And through an inclusion type of agenda, find where those issues are, whether it's a housing development or housing issues in Dedworth, or whether it's a kind of an issue about education or other things. That's the way, or vaccination, and childhood vaccination. All of these things actually are important, and through that system intelligence, we can work together with the Royal Borough and to be able to target where those interventions might come from. As I think, as well as that, having I think a bit more joined up working around health and care and doing the things that we're doing as well, and I think with that approach, we're more likely to then start to reverse some of those changes.
Thank you, Adrian.
I've just seen Sheila Holmes is on the line, which is great to kind of see Sheila here. And Sheila was supporting our work over many years, and so it's great to see Sheila. Hi.
It's of her here.
I think you've got to go in a few minutes. Can you just take Eddie's question?
Yep.
You can tell by my Yorkshire accent, I'm a local lad from Maidenhead. We've got some wonderful services in Frimley and Wexham Park. The improvement that Rod has shown is brilliant. But if I fall over and cut myself or break my leg in Maidenhead, I've got to go to Slough. Is there any thoughts about a little bit of decentralisation so I can get immediate care in Maidenhead?
Yeah, I think this is absolutely one of the things that we have got to kind of think about. I think we've got new, there's a lot of regeneration, and there's a lot of housing kind of being built in Maidenhead. There's a lot of plans around that, and thinking about some of building on the services that have been developed so far. And we've got the assets of St Mark's Hospital, which is a local. We're lucky actually in both Windsor and Maidenhead. We've got local assets, but I think we have to shape those assets in the right kind of way to be able to say what goes where and provide.
And use them, Adrian.
Pardon?
And use them.
And use them, yeah, absolutely.
They're not used.
Yeah, and I think use them in the right kind of way. But some of them, especially St Mark's is an aging estate.
Absolutely.
Which needs to be a bit more fit for purpose, and I know that there are plans around that and developing that estate in the right kind of way so that it keeps the right kind of services for your population. So I think you're right. There's more work to be done to do that, to develop general practice services as well, and to develop that within the context of more urgent care or urgent care services. And I think that is a challenge going forward, especially after during the pandemic, where we've had to kind of rationalize some of those kind of services which have been going on. And
use and encourage self-help.
Yes. Yeah.
People need more help to help themselves.
Yeah, absolutely. And that's really one of the things that we want, that supported self-care, when it's appropriate and when people can do it, is actually really important.
Adrian, I think you have another meeting at 11 that you have to go to. So it just remains for me to thank you for such an informative talk. It's a journey. We're on a journey. We've made improvements, and hopefully these improvements in line will carry on. So we look forward to it. And thank you very much. Paul's got a hand up. Is there something, Paul? No.
No, that's a clap.
Clap. Right. Well, I think everybody will give Adrian a clap for that talk.
Thanks very much, and look forward to meeting up with you soon. Take care. Bye-bye.
Thank you, Adrian. So were you trying to catch Adrian, Greg?
I was. The question I just had for him quickly was, those oximeters that he was talking about, they're really very good. My cousin developed COVID, and he was, he was at home, and he was telling me that he was sort of, short of breath and that sort of thing. And I persuaded him to go to Amazon and buy one for, 10 quid or whatever it was. Came within 30 minutes, however Amazon do it, and he was checked his own oxygen, was very low, and went to hospital and was hospitalized for a week, and was very, very ill. Now, why don't, with these oximeters, they are very cheap and they're a real lifesaver. Do we give those out free with every positive COVID test?
I can answer that.
Don't think so.
I can answer that, actually. You can request them automatically if you're receiving health and social care support, and particularly if you already have an existing health condition that means you may have breathing difficulties. Therefore, quite a few local GPs and the hospitals, if people have been in, even if they've been in for other things, if they've known throughout the pandemic that they maybe more susceptible to COVID, then they've sent them home with them. And I know that some have been delivered locally, particularly in the Berkshire West area, but throughout the Berkshire area. So it's become a real lifesaver for many people.
Thank you, Fiona. That's good. Where we are on the agenda, I'm going to introduce Eddie in a minute, who's just going to give an update on OPAF activities, and also then Michael Murphy is going to say a few words, and hopefully we'll have a little bit of time after that for an open discussion if anyone's got any more of these types of questions. So I'll hand over to you, Eddie.
So I hope you can all hear me. My name's Eddie Pikert. I'm the Vice Chairman of OPAF, and I would like to introduce you all to OPAF and to ask you to become members. We are a group that has sort of kept meeting during COVID, and we've kind of realized that this type of meeting is where life is going to be at for the future. So this is the first of our open meetings. We're going to have other open meetings. The next one is scheduled for August, and look at my notes here. Next one's scheduled for Wednesday, the 11th of August. So if you want to be part of that, you're welcome. So we're looking to renew our membership, because we're all getting older, and to renew our steering committee. So there's a kind of open invitation to there. And I'm going to use a few of Adrian's words. We want to be a voice for older people, to support, to challenge and shape what's going on. I look at we've been talking about health and social care and the integration. And in the past 20 years, there's been 12 white papers and 5 independent reviews. It's a constant reshaping of all of these things, and we want OPAF to be a voice in that. We've been having a good, I think, for want of a better word, bitch at our local folks in charge, and we've actually knocked on an open door. I think we've got some really good news with Councillor Greg there and Michael Murphy. We've been saying we need a strategy for older people, and I'm an engineer, so I look at paperwork and documentation, and I couldn't find an awful lot of documentation about an aging population. The borough plan says that by 2036, we're going to have in our borough 9,622 more long-term people with health problems. And yet I can't actually see how that transpires. And in terms of putting that into action. So part of what we're doing with Michael Murphy, I hope he's going to come and talk to us next time. He's the director for older people in Optalis, and with Greg, is to get a little strategy together, because COVID has meant that we've lost things like the Ageing Well Board. So we're hoping that OPAF becomes a friendly voice to support, challenge and shape, and to move looking after older people forward. I think Dr. Hayter has filled my brain with so much stuff now. It is a complex issue, and I think we're all in it together. So you're all welcome to come and join us, and to support us, and to come to our next open meeting and the steering board. I think that's enough to say about that. We want to follow a model in Maidenhead that Dedworth and Clewar are doing in terms of the inclusion of voluntary services. They're tackling a number of issues, and that's going to be a model, I hope, for Maidenhead and Windsor, tackling things like loneliness and isolation, active aging, helping yourself, and also having a place we can go to as older people to talk to somebody. It's not just about internet and networks. About 20 or 30 of our members in OPAF don't have access to this, and they're hard to reach. And we're worried because it costs us a bit of money. We don't have a lot of funding, but we have enough to keep us going. So it's reaching those folk that's hard to reach is a problem. It's nice to talk to you lot who can establish a computer, but it's as Greg said, important to bring the other folks along with us. And so my dream, if you like, is that we in Maidenhead, we all of us, because we're all in it together, establish an age-friendly system, a bit like the Age UK's age-friendly town leaflet. Oh, that's a plug for Fiona, and working together with people like Age UK, and basically the World Health Organization's Friendly Cities program. So that, you know, it's about having places to sit down, to have a pee, to be able to communicate with others, have a connected community. So we're hoping that OPAF will be a force for good in that regard. And we've got smashing people like Greg and Michael on board, and Sheila as our president, just to push around the edges. Because if we can shape the borough of Maidenhead to be age friendly, then it will improve everyone's lives. And end of speech. So come and join us.
Thank you, Eddie. Mona, you had your hand up for a moment. Was that a question? No.
Myself, because I live in Wokingham. I don't live in Maidenhead, I live in Wokingham.
Well, take the concepts we've got on offer, and Wokingham, Maidenhead is a bloody good place to live, second only to Wokingham, in the sense that in the sense of healthy life expectancy. We start from a really good spot. You know, I've had a bitch, but I also know our statistics are really good. And my worry is if we don't keep on top of it, we'll kind of lose some of our advantage. You know, it's kind of weird, but creating a level playing field, I don't want us to go down and others to come up. I want us to stay where we are and the rest to come up. So, you know, there's a danger that we can dilute what we've got, because we're in a good place, but we need to keep it good and keep working to stay there in terms of our healthy life expectancy.
Thank you, Eddie. I'll hand over to Michael Murphy, who wants to say a few words at the moment. You're on mute, Michael.
Rod, it's Sheila. Can I say a few words at some point?
Certainly, Sheila, after Michael. Michael, you're on mute.
I'm back now. Sorry, my apologies. All right, no worries. So I wanted first of all to reflect back on.
Michael, can you speak into your microphone? I'm hard of hearing.
My apologies. Sorry, Rona. Apologies. Is that better?
Yes, thank you.
Okay, good. I first of all wanted to make reference to the close working that's going on between ourselves and health, as evidenced in the speaker's presentation, and just to assure you that those developments are tangible and making a significant impact, both through the local access point where health and social care work together cohesively around ensuring that people with particular needs get the appropriate mix of integrated services. Also, in terms of the care home review team and the work within care homes, some really, I think, groundbreaking class-leading work has been done there in terms of joining up health and social care support to some of the care homes, and that's been broadened out to more care homes. And as was referred to in terms of during the COVID period, I think that response was incredibly helpful to solidifying and strengthening our joint response to, probably I think those of, probably the greatest challenge I've faced in quite a long career in terms of complexity of services, pressure within the service. So I think what you heard there was a really exciting account. And if I've been around a bit in terms of working across England, Wales and Scotland, and actually some of the developments that you have here are, I think, at the leading edge of joint working. and indeed outpace some places that purport to be much, the epitome of joint working here is very strong in terms of that particular process. I'd also like to emphasize the importance of OPAF, and some very kind words have been said about my engagement in it. I think it's mutual in the sense that we rely on organisations like yourselves to actually give the kind of insight and support to the sorts of strategic processes that we're engaged in. You add a dimension to that, which is incredibly valuable from that point of view. And again, for the previous speakers, all the conversations there around lay experts, support from the community, input from the community is absolutely critical to getting all this right. In that vein, I know that colleagues have talked to Jessel around engagement in the embedding community response groups at a local level, which are coming to most localities within the borough soon. And the other place where these things are being joined up now is in the joint CCG Place Committee. And I think you hopefully are aware, or you should be aware, or will be aware, that there's a stakeholder event being held on the 20th of April, which your organisation has been invited to, which is around the perennial challenge of how do we engage community groups in health and social care work. So if that invite hasn't come to you, I was led to believe it had. If it hasn't, I'll make that link now today. So that's where those discussions at another level across health and social care have been mediated, and the stakeholder groups there for that. So in terms of your membership, in terms of broadening the membership, I think people can be more assured that actually there are channels of engagement up and down in terms of interface with community support and health and social care development as we go forward. Is that okay? So,
yeah, thank you, Michael, for
no worries.
that overview. That's really helpful. From our perspective during the pandemic, the health service, I think, has responded magnificently, but also the Royal Boroughs responded magnificently. And what's really good is seeing the really close cooperation that's been taking place and developing, and hopefully that will carry on and continue to develop. So,
yeah. Chair, if I may, one of the during the colleagues were very kind to me in January when I promised I'd attend and had something else to do. What I had to do at that stage was I was managing a process of with health colleagues where we met 3 times a day around moving people from hospitals as quickly as possible. Community health played an absolutely critical part in that. So I think I just wanted to add to that appreciation of the really hard work that went on during that period.
Yeah. Just added information in terms of patients that have come through Frimley and been discharged with COVID, it's now over 4,000. So it was not a small number. It was a major task going through. So thanks to everyone involved on that.
Chair, could you please just try and help make sure it never happens again? Sorry, I'm joking.
Hopefully, yes.
Sorry, I didn't mean that, but you know what I'm saying.
With that, we've got about 10 minutes for any questions. I know you wanted to say something, Sheila. Do you want to do that? And then
what I wanted to say was if you would all pay attention and actually do something in the word in the sense of self-help, would you all please look and see what you should be doing to look after yourselves and to help your friends look after themselves? What I would love to see is a room or a location at St. Mark's where people could go and drink their coffee and actually meet, particularly for the elderly. It always seemed to me, since I've lived here, that St Mark's is a resource that is just not used, and it certainly should be. I mean, it should be used for people, not just for health and social care. It should be used as a people facility, and it certainly isn't. I mean, yes, the Ark is there now, but who knows what the Ark is? Do you all know what the Ark is? No, I don't suppose you do. Why should you? The one other thing I just wanted you to do, please, is look at the website and look at the eulogy that one of our members' daughters has written about him. Colin Robinson was involved in OPAF nearly as long as I've been. I'm not going to go back all over again where it started, but Colin Robinson unfortunately did die. He only died about a month ago, and he was an aged gentleman who was very interesting. And I would encourage you to read his eulogy on the website. His daughter, one of his daughters, wrote it, and it's fascinating. What an interesting man he was, and we all, those of us who knew him, enjoyed his company and knew it. And the other thing I was just going to say was, we know that Jessel was involved with the Ageing Well Board, and we do feel very strongly that there does need to be a facility of some sort where older people could actually get information that they want when they want it, not when they were going to be given it. And I would encourage people like Michael and Greg to make use of facilities like St Mark's to actually have a meeting place where people could meeting properly, or they could virtually have a meeting place. The WRVS do an absolute the RVS do a brilliant job with the coffee, and it's very drinkable. And there is a canteen at St Mark's, which actually could be used as a meeting place as well. So please, can we have somebody thinking about hard facilities like a meeting place that's either virtual or real, please, for the future. But can I just double check with Roger that the eulogy is on the website?
Roger?
Yeah.
It is there, Sheila. It's under the news. If you look at the menu, it's under the news headings, and it's just there.
It's well worth reading, isn't it, Roger?
It is.
Wonderful.
He's a guy that I've known, well, 6 or 7 years, and I didn't realise quite what he had done. He did try to describe to me how radiology works on one occasion, and I thought it's all changed since you've worked on it. But he was great. He was lovely to talk to.
He was such an interesting man.
Yeah.
We were so lucky to have actually known him. But do read the eulogy. His daughter's written it beautifully, and there are some very interesting and entertaining photographs. I'm sorry I never took one of him myself, though we have got. I must go through my list. Some of the AGMs and meetings we've had in the past, I have got him on them. I've got quite a lot of you, and I think perhaps that might be worth doing, Roger, on the website, putting some photos on.
We have an archive,
Yes. Yes.
Thanks. We're running towards the end of the meeting. Can I just see if anyone else has questions? Did you have your hand up, Rona? No?
No.
No, no.
No, okay. Has anybody else got any specific questions that I'd like to ask or comments I'd like to make?
I would like to please, Rod, to stress the importance of frailty and what it is and how it works and what you should do about it.
Okay. Fiona, yes.
Yeah, just to say, I've got a really interesting report that was done on both a local basis and a national basis around the effects of the pandemic on frailty and on physical health, on mental health, and on general health and well-being for the older population. So I'd be more than happy to share that. I'm sure nothing in there that's news to anybody, but I think some of the scale of the difficulties that older people have encountered, and certainly some of the people that we've seen over the last year who haven't been out of their house for a year, has really meant that the frailty side that Sheila mentions has come more into focus than I think it ever has done before.
Oh, thank you.
I think it's something, Fiona, that really needs addressing, because
Yeah,
people
I agree.
don't, you know, I know you have and you are, but it needs actually really concretely addressing, because people don't realise that you don't have to be old to be frail.
Yeah, absolutely.
No, thank you. Sarah?
Yeah, I just wanted to say thank you to Sheila for mentioning Royal Voluntary Service. I know that we haven't been in the borough for some time, as when we lost our Good Neighbours Befriending Service. However, we have been delivering the NHS Volunteer Responders Service. So I believe that we've been doing some great work helping people out in their needs. So that's all I wanted to say, really, that you know, we are still here, Royal Voluntary Service. We've still got a lot of volunteers in the background that can support and welcome any invites to any of your local meetings, OPAF or whatever it is. Yeah.
We always have invited you, actually.
Oh, thank you. I've not seen you. Oh, I might have, but keep sending me the invitations. I'd love to attend.
Thank you. Mary, did you have a question?
No, it was just a reaction to Fiona. That would be a really good report to see.
Yeah. Can that be circulated wider, Fiona?
Of course it can. What I'll do is I'll send it to Eddie, whose email address I've got, and then if you circulate it, then more than happy to.
The reason I ask with Mary's question is we're both public governors of the Frimley Health Trust, and I'm sure the governors there would like to see it as well, if that's okay.
Sure, of course, no problem.
That's great. Thank you.
Rod, can I just I'm not promoting it, but the draft NHS plan for the needs to be, you know, the new draft white paper. People do need to know about it, because it might actually produce something eventually.
Yes.
Patricia had a hand up, Rod.
That's what Adrian was talking about, Sheila. But Patricia, can you unmute?
You need to unmute.
Patricia, can you unmute?
Yes, that's
Thank
it. I'm not sure how to get rid of the hand now that I've put up there.
I click on it again, but don't worry.
I'm just wondering if anybody else, I'm from Maidenhead, and I'm wondering if I am the only one who's noticed that the lack of seating in Maidenhead. When you go,
yes,
you go, if you park in the Nicholson Centre, for example, there is nowhere to sit. You know, as far as Marks and Spencers, who have one seat, one in there at the bottom of their now unused escalator, but shopping is just not. There's nowhere to rest. You have to rush about and lean on things, you know, just to get a rest. Am I alone in that?
No, but under COVID, of course, you were not encouraged to sit next to anybody else.
I understand that they took the benches away in the thing, but that is not helpful. It seems to be it sort of puts you off even going in there, to be honest.
Yes.
And I wondered if anything could be done, you know, just a single seat dotted about the place. I understand that the young folk will be gathering around benches and eating stuff, so they took the benches away. I understand all that and the logic and everything, but it doesn't detract from the fact that it is a problem for folk who might just want to stop and rest for a few seconds. and then go on about their business.
Yeah, thank you, Patricia. I see Greg's got a hand up.
We've been constantly.
Sorry, Greg's got a hand up who wants to speak. Can I? Greg?
Thanks, Patricia. That's very interesting. So the problem you're raising there is within the shops.
No, it's within the whole centre. We're within getting from your car
in
to
the borough plan.
Any of the shops.
Right. Okay.
You know, it's not the joy that it once was. I mean, you can't eat.
No.
I suppose now you'd be able to sit on maybe one of the 2 tables outside near the coffee place, if they're allowed to serve coffees. But when they were during the lockdown, even the cafes didn't have the seating outside.
No.
There was nowhere.
I think a fair bit of that was COVID measures, but you're quite right. We will have a look at it. I know that with the redevelopment of Nicholson's Centre, the Accessibility Forum were very keen and were quite involved in ensuring that there was, proper bench, enough benches and that sort of thing, and also for mobility and so on. And they have actually changed their designs to accommodate this for a lot of people. So it is high on the agenda. I think you'll see in the high street things coming back as things improve. But the one about inside shops, you're quite right. I do remember there always used to be like a few seats by the lift or a few seats, here dotted around, but they're just for people to take a break. But yeah, I'm thinking, I don't think I see those anymore either.
No, there aren't many loos.
But there never was a bench down by the Superdrug, down that leg of the Nicholson Centre. And I was quoted, always fire regulations, but they could have a single strip of seating, and that wouldn't have interfered with fire regulations. You don't have to have a sort of a huge bench where you can have sort of 10 people sitting on it. A single strip of maybe 3 or 4 seats side by side, that people would sit and rest. But nobody was really interested in putting benching in for the older. As you get older, you feel unwelcome.
No, I absolutely get it, Patricia. I'll mention it to Steph, who's the town centre manager, and just to ensure that what we had before it comes back. Whether they'll invest any more in Nicholson's Walk, I don't know, because of its imminent, redevelopment. But I'll ask the question anyway.
Thank you.
Yeah, thank you, Patricia. I think this shows one of the sort of benefits of these types of meetings, because Councillor Greg now is aware of that and can raise it as well. So that's really good. Beth and Pete, is it Beth and Pete?
Yes, that's right. I just want to say how much I've enjoyed this meeting, and thank you very much for all the speakers and the very, very good job that they're doing. And I think Sheila's idea about having a meeting as well, where we can have a coffee and a chat, would be absolutely great. Maybe the suggestion about St Mark's Hospital, if there's a room there, would be absolutely ideal. Thank you very much, everybody, and lovely to see you all.
Rod, I suggest we have our last question from Damien.
Talking about the seating, about the Nicholson Centre, on the high street itself, I noticed a bench was removed from there. First of all, possibly some vandals had broken it, and then after that, they came around and removed the whole seat and tarred over it. So they removed from the high street a bench, and as the lady was saying, sometimes you just need to sit down for a few seconds to carry on. But that was totally removed. So in the high street, I cannot see a reason why it should be removed. That was more or less just outside the Centre Nicholson entrance from the high street.
Okay, thank you, Eddie. It just leaves me now to thank everybody, and as Beth has done for the speakers, and especially to thank everybody who's come. We are planning as we move ahead, so if anybody has any key points they would like on future meetings, please either send them to Marjorie, our secretary, who should have the email, or I leave the box open on the right. You can type them on into the side chat before you go. That would be helpful. And similarly, if anybody's not a member and would like to join, they could either send a request to Marjorie or just type the contact in the sidebar and we will contact you on that side. In terms of meeting formats, this is the first Zoom meeting that we've done. The feeling I'm getting is that people have appreciated and enjoyed it. Is this something that you value and we would
Yes.
repeat? Let's just get a general feeling.
Yes.
Yeah.
Okay, that's fine. It's good to get some feedback. And I'll say any feedback you can give us in terms of any content that you want from the meetings or any comments, that'd be really great. Is there anything you want to say, Eddie, before we go, or Roger?
No, just join OPAF. It's simple. It doesn't cost you anything, and the more members we have, the bigger the voice we have, and we might get some action on benches. Sorry, Craig.
Eddie, and lose some water.
The list goes on, but yes.
Yes.
Yeah.
Okay.
Lose and water facilities.
Lose, yeah, places to pee.
Yeah.
Okay. Well, thank you. I didn't mention at the beginning, I hope it's no problem, but this has been recorded just so if we need to refer to anything. So if anybody's got any problems with that, please let me know on that side. So with that, that is the end of the meeting. It's 11:30 when it was scheduled to end, but I'll leave the Zoom open for any comments that anybody might like to make on the chat box for about 5 or 10 minutes. So other than that, thank you very much for attending, and any comments you can give, really appreciate it. Thank you.
Thanks,
Thank you very much. Bye. Thank you.
Bye.
Thank you for recording.